Thank you and welcome to the show this morning. The topic this morning is crime and religion. And we have with us to talk about crime and religion this morning Dr. DrCPoe1. Dr. Poe is a psychiatrist in private practice here in Nashville, Tennessee. And of course, Dr. Poe, let me welcome you to the show this morning.
Thank you very much.
And to talk about, Dr. Poe, what I consider to be a very, very important topic, and that is crime and religion. And I'm sure that you're going to bring to us this morning quite a bit of information about the relationship between crime and religion. But before we get into that, Dr. Poe, let us have you to give us some information about your background, your education, and some of the things that were important in terms of eventually bringing you to the study that you're going to talk about and some of the other things in your life. Let's do that, and then we'll get into a topic of the inmate study that you and others did.
I'm a graduate of Tennessee State University, class of 1960, and then I left TSU and went to Meharry and finished in 1964. Spent 2 years in service in Korea and came back to Berkeley, California, did a residency in psychiatry. I was in private practice in California for about 9 years, and then about 1977, actually, we returned to Nashville and was called to preach the gospel in 1977. And so since that time I've been in private practice, but practice of Christian psychiatry. And we got involved in doing some jail research, actually research involving inmates at the Metro Jail in July of 1998, and that study extended for a period of about 13 months. We concluded that study the 31st of August of last year, and we feel that the Holy Spirit reveals some very interesting things about violence as it relates to spirituality.
You know, I think, Dr. Poe, let's sort of move right into that, dealing with crime and religion, because I think you've already indicated that your ministerial background has given you a special perspective in terms of dealing with this as an issue. And we also noticed that you use the word Christian psychiatry. Explain what you mean by all of that, and then get into how this inmate study came about and that relationship between all of that.
Right. Well, when I say I'm a Christian psychiatrist, that means that I integrate my faith in God into my practice of psychiatry. Now, in terms of the research at the Metro Jail, I feel that it was inspiration from the Holy Spirit that we became curious as to what we would find in terms of the deeper understanding of violence if we were to include, in addition to the traditional evaluations such as sociological evaluation, psychological evaluation, psychiatric evaluation, if we were to include in those traditional perspectives a spiritual perspective or a spiritual assessment. So then we assembled a team of investigators, you might say, and we evaluated 25 inmates at the Metro Jail who had been charged with a felony, either robbery, rape, incest, or aggravated assault, or murder. And we evaluated them from these various perspectives, but we included a spiritual, and our assumption was on the front end that we would come up with a better understanding of why some people choose violence as a lifestyle.
And of course that spiritual perspective is sort of introducing a new concept and a new way of doing things in the area that you're involved in, is it not?
Well, that's true. I mean, normally when a psychiatrist evaluates a problem like violent behavior, he does not include a spiritual assessment. All right, so we did in this particular research.
Now, what did your spiritual assessment tell you in reference to the study that you did not know earlier as a psychiatrist and primarily as a Christian psychiatrist? I mean, what did it tell you? Or did the possibility of you being a Christian psychiatrist add any additional information to that for you?
Yes, it did, because one, we did a spiritual survey on each of the 25 inmates, and that was done by a minister, an ordained minister. What we found is that in 92% of the inmates that we assessed, they came out of family situations in which there was clearly a lack of spiritual nurture and guidance on the part of the parents, and especially on the part of the fathers who in 6 to 8% of these cases was outside of the home, was absent from the home.
And so there's a very, very close relationship. What you're saying is that young people who become eventually involved in violence, that there are more of those who never had that Christian, well, not that the spiritual experience that you're talking about. Is that what we're saying?
Yes, I'm saying that if you look at the spiritual background or the religious background of persons who have a history of repetitive, antisocial, or criminal behavior, what you'll often find is that they've grown up in a family situation in which one or both parents were very self-centered. Self-centered means that they were focused on their own needs, focused on gratifying their own desires, and therefore did not offer the kind of spiritual role model or the kind of spiritual instruction that a child needs in order to develop a good sense of who he is and a good sense of who God is and what God expects and requires.
And those young people who were not exposed to that kind of influence came out on the short end of things. Would that be a necessity?
Yes, as a matter of fact, the men that we evaluated, all of them tested as having low or very low self-esteem. 70% of them responded to the question, how do you handle it when somebody mistreats you or takes advantage of you? 70% of the men we evaluated said, I believe in trying to get even or trying to get
78%.
78%, yes. Also, we found in our study that almost all of these men, about 92%, suffered from a significant degree of self-hate. And so these phenomena are normally viewed as psychological, but I'm convinced that low self-esteem or very low self-esteem and self-hate are spiritual phenomena, okay, that we see very often in situations, family situations of spiritual neglect, and where a person neglects utilizing or drawing upon their spiritual resources, one of which is faith in God and regular prayer.
And if more people understood this, is that what we're saying, that perhaps we would be able to deal with some of the real crucial problems that we have dealing with violence in our society? Is that what we're saying?
Yes, I'm saying that self-esteem is a spiritual phenomenon. Low or very low self-esteem are also spiritual phenomena. Our study of these 25 inmates revealed, based on the Tennessee Self-Concept Profile, that 92% of these men had either low or very low self-esteem. So we're saying that spiritual neglect was at the basis of this low or very low self-esteem. And we're saying that if we are to correct that kind of a problem, then we need to recognize the true nature of self-esteem, and we need to develop the kind of therapeutic interventions, okay, or the kind of spirituality-based prevention that will help people develop positive self-esteem, or if they develop low self-esteem, then to help them to overcome it.
And of course, recognizing immediately that these individuals probably grew up in what you call a self-centered environment around themselves. These are the individuals with this self-centered ego kind of thing that will be responsible for determining the young people that they have charge of. And of course, if they are no better than being self-centered, the young people could not be exposed to anything. Well, how do you get young people into such activities that would sort of break that tie that they have with those self-centered individuals and open them up to a wider view of things, as you talked about?
Well, I think there have been some studies that have shown that adolescents who attend church on a regular basis have a lower prevalence rate of drug abuse and antisocial behavior.
Very good.
Okay? So we know for a fact that...
Let me interrupt here, Dr. Poe, for this first commercial break, and we'll be back with you following this short commercial break. Poe